Greetings, everyone. Welcome to another episode of The Professionals You Should Know. This show is about uncovering the journeys of professionals from different industries. And today, we have the outstanding and insightful Rakaya Adeoye, who is a pelvic health physiotherapist. Thank you very much for coming on. So, what is it that you do?
So I am a pelvic health physiotherapist. So I am a physiotherapist by background, and then I specialise in pelvic health, which is basically a mixture of women's health and or men's health.
Okay.
So yeah, that's what I do.
What was your journey? How did you become a women's health physio?
A women's health physio. So I suppose I went to uni, very standard kind of a route into physiotherapy. So studied physiotherapy for 3 years, and then went on rotations, as you well know, which is kind of like the traditional route for most physiotherapists who want to work in the NHS at least. So I worked rotationally for a good maybe 3 or 4 years, which was great. Gave me lots of experience in the wide range of different areas that you can work within physiotherapy. And then I decided that I wanted to try something a little bit different, slightly against the grain. I've always been very much involved from a community perspective, just within my local community with women's health, and just trying to kind of work around a lot of the issues that women have in general. And I think that was something that I was very conscious wasn't really present in my professional life. And I was aware that there was an opportunity for that. So I looked into working with some of the women's health physiotherapists within my trust at the time. And they were really lovely, very kind of great. Gave me lots of opportunities to observe them and things like that. And I just loved it, fell in love with it, and applied for a training post, which I got, which was great. Just went from there.
So, you said in the community you work with a lot of the women in the community. What about men as well? Do you also do men?
So within my community, it was probably, I wouldn't say it was women specifically. I probably ended up working mostly with women just by nature of me being a woman. However, just working within the general community, within the elderly community especially, because before women's health, I was kind of moving towards elderly care, dementia management and things like that as a physiotherapist. That just wasn't quite doing it for me, although it was great, and it's still an area that I'm still quite passionate about. So community-wise, within my local community, it was elderly care.
Okay.
Which then led me into women's health.
So do you also work with men's health as well?
At the moment, no.
Okay, just
you can do, which is why I said pelvic health
rather
rather
than
okay. Women's or men's specifically.
Right.
But a lot of posts, particularly within the NHS, will specify women's health. There are very few that specify men's health alone, but then at the moment, just by nature of kind of being inclusive and really offering men the opportunity to improve with some of the pelvic health conditions that they can have as well. They will have pelvic health roles, and as such, we are trained to be able to treat men as well, which is something I have done in previous posts, but my last 2 posts specifically were women's health.
That's amazing. So what made you want to become a physiotherapist and then specialise in pelvic health?
It's strange. I knew you were going to ask that question. I don't really know, if I'm honest. I've kind of racked my brain about kind of what drew me to physiotherapy specifically. I'd always known that I wanted to work in healthcare. I think traditionally, as coming from an African background, there are certain kind of careers that are encouraged. But again, my parents weren't particularly kind of strict in that respect at all. They just wanted me to do something that would kind of be secure, something that would allow me to demonstrate my academic ability, and something that I enjoyed. So when I said to them I wanted to do physiotherapy after going through a number of different careers, they were like, "Oh, okay, actually that sounds like you've always been very sporty on every single every single team at school, bar hockey.
Really?
I've always loved being active, and so that was something that drew me to physiotherapy. Not that I've done anything sports specific since then. All of my kind of roles have been very much clinically inclined as opposed to a kind of sports rehabilitation or anything specifically musculoskeletal in that respect.
I see. And is there any, like, because I know you then went into pelvic health.
Yeah.
Is there any kind of stories that kind of reinforce that, yeah, this is actually the position that I like to be in?
I think, as in for physiotherapy or pelvic health?
Pelvic health.
Pelvic health.
Because that's what you specialise in.
I think it was the observations that I did. I think observing the patient group that was being presented in clinic every day, the wide range of different women, different ages, different kind of life stages, all with problems that kind of originated really with something to do with the pelvis. It just really opened my eyes to kind of my own health as a woman, and just kind of being aware of some of the conditions that can present themselves, some of the risk factors that a lot of women are not aware of at all, that can really kind of have a massive impact on your life long term. And I think for me it was that opportunity to really kind of get in there first and help women to prevent certain conditions, and also help women who are really suffering with certain conditions to have a wholesome life, have a life that they're able to really enjoy. And I think it's obviously health-wise, it's a massive deal to be able to enjoy your life, and when something like that is taken away bit by bit, it can be really debilitating. So seeing those women come in, get help, evidence-based help that was really quite useful to them, that was like, right, I think this is something I can do.
Was there like one, I know there's probably thousands of patients, but was there one particular patient that really kind of got you thinking, yeah, this I really helped, or you know, this was an amazing result?
It's hard to narrow it down. It really is hard to narrow it down. I literally see women who are pregnant. I see kind of like teenagers, so I was going to say prepubescent, but not clinically, although we have a massive role within the paediatric kind of...
Oh, really?
Yeah, no, definitely. Yeah, I mean, I guess they have pelvic floors as well, don't they?
Of course they
so a lot of kids who are really struggling with pelvic floor dysfunction, whether that's continence issues, mostly continence-related issues. That's something that we can equally influence as well. So yeah, I again, the range is massive. Menopausal, postmenopausal women as well, the age range within those childbearing years as well. There's just such a wide range. I'd say within each of those, I have specific patients that have really kind of been like, real light bulb moments for me to know that this is where I belong.
Okay, that's interesting. And who do you feel that like appreciates your service? It could be patients, government, colleagues.
I'd say mostly patients. Really, I think it has such a massive impact on their lives. So if you consider, for example, a woman who's pregnant, struggling with pelvic pain throughout her pregnancy, I mean, it's a good long slog to be in pain, knowing that you're going to continue to be in pain for however many months. So being able to have that woman come in, teach her ways to manage her pain, help her to alleviate her pain somewhat. We don't fix people, we help them to manage their pain. That can be, that's massive. It can really change her whole experience of that pregnancy. So that's one example. But then you have women who are postmenopausal or kind of been suddenly thrown into kind of symptoms that they were not expecting at all, and being able to say to them, okay, this is how you can manage your symptoms and still have a fulfilling life. You can still do the activities you want to do. You can still spend time with your grandchildren and lift them and use your body. It's not all over. Just really trying to help women in that respect is just great. So I think those patients appreciate me.
Definitely.
I think, well, I know they appreciate me. I've got plenty of chocolates and cards and stuff like that kind of just reinforce the messages of, I didn't think there was hope. I didn't think there was anything that could help. And being able to see a pelvic health physiotherapist, a lot of them not knowing who pelvic health physiotherapists are, what we do, that they have access to us. It really does. It's quite rewarding.
So, like, how would assessment look like? What was it?
Okay.
Yeah.
So an assessment, I think a lot of people are scared when they hear like pelvic health physiotherapy. Like, what are we going to do?
Yeah.
Pelvic floor exercises. Like, am I going to have to get on the floor? I get that a lot, and it's like, no, it's your pelvic floor, which a lot of people don't know. They don't know what their pelvic floor muscles are. So and whilst I do specialise in pelvic floor kind of muscles and the musculature and the whole kind of pelvic region, it's not isolated. You can't really isolate this region from everything else above and below. So an assessment would definitely kind of involve holistically looking at the whole woman, in my case. So kind of things like posture, musculoskeletal stuff, walking pattern, etc. Things that my colleagues are very much kind of able to do as well. I suppose the difference then becomes when it comes down to the assessment of the pelvic floor muscles themselves. So the pelvic floor muscles are a sling of muscles that run from your coccyx bone at the back all the way to the front of your pubic bone and either side. So literally, if you were to find those bony points on yourself, so the pubic bone at the front and the coccyx at the back, and then your sitting bones, if you were to pop your hands underneath your bottom and just have a little wriggle, you can feel your sitting bones there as well. So if you think about that whole diaphragm of muscles that basically for women hold everything up and together, in order to assess them, we need to do a vaginal examination. So that is the gold standard assessment, would be an internal examination, although there are ways of assessing the pelvic floor muscles without necessarily having to do an internal for whatever reason. For example, with the teenagers or pubescent kind of population, I wouldn't do an internal examination with those patients, but there is a lot that I can do in terms of ultrasound, for example.
You do ultrasound?
Yeah, so scanning as well to see what those muscles are doing using specific probes. We're able to see what the muscles are doing or whether they're working appropriately. But the gold standard is definitely an internal examination.
And would you use the same ultrasound for the women that are slightly older?
I mean, I routinely do an internal examination unless there's a very specific reason not to. But yes, there are certain people who aren't comfortable with having an internal examination, for example. So there's always the option. Because at the end of the day, I'm trying to improve that patient's health. So I need to assess them, and if I can't do the internal, I can't write them off because of that.
I see. I didn't know that. I really didn't know that.
It's definitely not something I was aware of in my general physiotherapy kind of training. I wasn't aware of a number of different areas that physiotherapists can specialise in, and the things that we can do in those areas. So women's health, when I kind of was made aware of kind of the things that we do and the how unusual it is necessarily for someone who's not a doctor or a midwife or a nurse necessarily to do an internal examination. It can feel a bit odd, but actually it's necessary.
Do you do the like the rectal area as well?
Yeah, absolutely. So again, thinking about that kind of anatomy from back to front. So if we were to assess, a lot of patients will often ask me about kind of, how do I know if I'm doing my pelvic floor exercises correctly? And they're like, I can only feel if I'm squeezing from the back. And I'm like, okay, well, that's still your pelvic floor muscles. And we can't necessarily isolate the back from the front. Because it's a very complex set of muscles that work together. So in order to assess the rectal muscles as well, or the pelvic floor muscles, I could do a rectal examination as well. Which is what I would do for male patients. And
How does that go?
It's clinical, isn't it?
Yeah.
At the end of the day, it's very necessary for patients who have had specific types of surgery that have compromised their pelvic floor muscle function, specifically after maybe cancer treatments, for example. A lot of patients really struggle to regain control of their muscles, and that can affect not just things like continence from a urinary perspective, but from a bowel perspective as well.
Okay.
And if you think about the impact that has on a person's life, if they're not sure whether they're going to have an accident when they leave the house, it keeps people trapped in their homes. So if it means doing a rectal examination will help me to assess the muscle function, help that patient to learn how to engage those muscles properly and train those muscles, then that's again a necessity. But we can assess without necessarily doing a digital examination using a finger.
No, that's amazing, because I think a lot of people don't really understand how to use their pelvic floor as well, and don't even know that they exist. Especially some men as well. They, so absolutely. I really do feel that is an actual vital role, especially for everyone to do.
Totally, yeah.
Okay.
I think a lot of people struggle in that they don't know what these muscles do until there's a problem.
Yeah.
Even then. For women, for example, there are studies that suggest that it will take a woman 7 to 10 years to seek help for a pelvic floor dysfunction issue, which is a long time to suffer in silence. Yeah. It's a long time to kind of hide things from your family, kind of avoid invitations to do things, to stop playing sports, to stop doing activities. It's a long, long time to not seek help. Whether that's out of embarrassment, whether that's out of not knowing who can help, whether anything can help, feeling broken, etc. There are lots of different reasons that you can kind of empathise with to think that, okay, that's why they didn't seek help, but there is help out there.
Wow. And is there any misconception to your role at all?
I guess we probably have the same kind of misconceptions in the sense that whenever I say physiotherapist, it's like, oh, can you do my shoulder, my knee, my something? And I'm like, no, auntie, that's not the type of physio that I am, which is always really quite funny. But yeah, no, I think, people assume that all we do is massage, for example. I think a large part of my role, which I really love, is around kind of lifestyle and really kind of encouraging healthy lifestyles that will really impact on a person's health long term, much longer than me pressing into their soft tissue will do. Whilst there's a role for that, certainly, I think in terms of long term help, that is a massive misconception. Well, why would I go to pelvic floor physiotherapy if they're just what are they gonna massage? Which is not the case.
Wow. Yeah. No. I
completely
agree.
It's a common one.
The big one.
Definitely.
All right. So what we're going to do now is we're going to go to another part of the show.
Okay.
It's called Rapid Fire.
Cool.
Well, not really rapid.
I'm ready.
Yeah. Right. So it's either pick a choice or yes or no.
Okay.
All right. So for our first question, what do you feel is more important throughout pregnancy? To strengthen the pelvic floor muscles or learning to relax them?
Oh, I don't know. It's so dependent on the patient, and that's such. I love that you've brought that up there, because that is another thing in terms of strengthening your muscles, but also there's a massive role for relaxing your muscles as well. I'd say both. I wish I could say one specifically, but they're both as important as the other. So strengthening your muscles will help with support, it will help with maintaining continence, etc. All of the different things that can be slightly compromised as baby gets bigger and you're carrying a heavier load, so to speak. But in preparation for labour, especially, being able to relax your pelvic floor muscles effectively, using your breath, using your diaphragm, etc., without straining and pushing and just bearing down. There are consequences to different ways of birthing. So I'd say both.
If you had to pick.
If I had to pick, If I had to pick, I'd say strengthening on the basis that you can't have a strong pelvic floor muscle unless you have the ability to release and effectively let go. So, yeah, it's strength. Functional strength.
All right, good. All right. So for our second question, is a bruised tailbone common after pregnancy?
Common. Not necessarily.
Okay.
I wouldn't say so. No. It's definitely a complaint. Definitely something that we get a complaint about. But I wouldn't say that it's common. I suppose, again, that kind of the part of our role that is associated with preparation for birth and thinking about positions, thinking about breath, thinking about the way to birth. That's something that we can help with as well. And there are certain birthing positions that can make it a bit more difficult to have mobility within the coccyx, which is an already relatively immobile area. But by nature of immobile, it's much reduced in its range of movement compared to other joints, obviously. But it needs to have a degree of movement in order to birth baby. And I think certain positions restrict that. And those positions would likely lead to a bruised tailbone. Okay. And that can be difficult to, first of all, figure out what it is, apart from a searing pain in an area that you're not used to having pain in. But also what to do about it.
What position?
Okay, so the evidence would suggest that being more mobile and allowing the mother to find her position and be not restricted in her ability to change position is super duper important, really important. So one position that is particularly noted to have risks associated with pelvic floor dysfunction post-delivery would be lying flat on your back, specifically in stirrups, so having your knees wider apart. That is a position that can be quite damaging for the pelvic floor muscles. Now, of course, at the time of delivering baby, the number one thought isn't necessarily let's preserve the pelvic floor muscles. Of course, it's important and it should be something that is considered within a birthing plan, definitely, but it's not necessarily the top priority. However, if you can facilitate mum having a mobile birthing experience and being able to find intuitively where she wants to be, that's probably more important than anything else in terms of positioning. Sometimes that can't be facilitated. In fact, I think most of us who haven't been in a labour room would associate the most common position with being on your back. So a lot of women will get into that position thinking that's what they have to do. But listening to your body is really important. So yeah, that's probably the position to be careful of, so to speak.
Okay. Cool. But for the question was no.
No. Avoid.
Okay. So for our third and final question, what's more beneficial for the female anatomy? Yoga or high intensity training?
Okay. I mean, again, they literally, like, they both have massive benefits, definitely. And then equally, some people just aren't yoga people. Some people just don't get on with yoga. Some people don't get on with high intensity. Depends on the issue and what you're aiming to achieve as well. I know a lot of my ladies who have kind of endometriosis and issues in relation to hormone management and how that affects how well they're able to sustain certain levels of intensity during exercise. High intensity exercises are just not their bag really, and so kind of changing that to a more kind of low intensity sustained kind of style of exercising. Can't remember what it's called. I think it's LIT is the acronym for that, but basically it's lower intensity but sustained until the point of fatigue. That is more appropriate for that patient. Equally, there are patients who, I think I missed the question. Was this question specifically pregnancy related, or no? It was
Female
just
anatomy.
female. Okay, female anatomy then. Yeah, no, I'm totally on the same track. Definitely. I mean, I'd say pregnancy-wise, again, depends on the person. I would encourage women to maintain the level of activity that they've had pre-pregnancy if they can sustain that. I definitely probably wouldn't necessarily encourage taking up a whole new activity that you've never done before and really stressing your body in a way that it's very kind of not familiar with, at a time where it's compromised by nature of kind of like ligamentous to support of the joints are kind of, they're frazzled at that point by nature of some of the hormone changes that have been kind of ongoing and progressing throughout the pregnancy. So I mean, yeah, yoga is great for strength. It's kind of a bit of a secret worker. I really like how you can really get a good workout out of yoga without necessarily thinking you're working too hard. So that works really well for some people. It's really hard. It's dependent on the person, I'd say. But yoga is probably more universally kind of accepted. You can accepted. You can apply it to more patient groups, I suppose.
Okay, so yoga. Okay.
I'm a yogi. So.
Okay. So for our last few questions, in your opinion, where do you feel the healthcare industry will be without the professions of pelvic health physios?
I mean, we only just got here, really. No, I'm lying. We've been around for ages in a number of kind of under a number of different titles. Pelvic health physiotherapists have been doing the work, the necessary work to help patients with pelvic floor dysfunction for many, many years. So our body, the pelvic and obstetric and gynae physiotherapy body, which is under the Chartered Society of Physiotherapists, they have been working really hard, and as part of the Women's Health Strategy, which has come out more recently last year, they're really pushing for more pelvic health physiotherapists. Okay. So again, just by nature of the amount of women that are alive, and then by nature of the fact that just by being here and experiencing different life stages, that puts us at risk of certain conditions. So 1 in 3 women throughout their lifetime will experience some form of pelvic floor dysfunction. It's massive. It's a lot of women. Yeah. And that can range from, like I said, the continent side of things, but I haven't even touched on the pelvic pain, haven't touched on prolapse issues, haven't touched on postmenopausal issues as well, pregnancy, of course, etc. So throughout all of those life stages and with those women, they need help that physiotherapists can provide. We're the first kind of line of treatment before kind of, if you think about your conservative management options, you've got your kind of you've got your lifestyle side of things, you've got physiotherapy, and then it starts to go down the route of medications and surgery and things that actually have quite significant consequences, and are just by their very nature a lot more invasive. And I guess to throw it out there as well, they're costly as well. But physiotherapists, we're brilliant, really. At the end of the day, what we do, and the service that we provide is so kind of, it really is, what's the word? It's so robust. Like, we really do provide a great service that is based on evidence, which is the most important thing. So yeah, you'd be lost. Completely lost. There's literally, there's no chance. And I think, again, by nature of the fact that women are becoming more aware as well of the fact that these services are available to them and can help them with these significant symptoms, women are asking for referrals. They are making their voices heard and making it clear that they want to have their symptoms dealt with, and that they shouldn't necessarily have to do this on their own, or to kind of forget be forgotten, basically. So yeah, because of that, I don't think it's even possible for us to go away quietly.
Yeah, no, I completely agree. It's substantial work. You
Absolutely.
know, you guys, well, we do.
Definitely, nudge, nudge.
So, do you see your profession progressing in any way at all? So it could be like, I don't know, more status, what?
Okay, as in personally?
Personally and professionally, as in the industry.
Yeah, I mean, I guess professionally, like I said with the last question, the range of availability of pelvic health physiotherapists
Right.
hopefully is going to rocket in the next couple of years.
I can see that.
Which is great. The funding is now becoming available.
Oh, that's cool.
There's kind of nationwide perinatal pelvic floor physiotherapy services that are being developed as we speak, which is really exciting and great for patients, great for our other colleagues who work with us, and just bringing awareness to what we do. So professionally, no worries there. That's all very much in hand, I hope. But then personally, I guess going back to what I was talking about probably quite earlier in terms of physiotherapy specifically, and the range of opportunities that we have to practice, whether that's in research, whether that's in academia, whether that's in clinically as well, service development. There are lots of different ways that we as physiotherapists can use our transferable skills. So yeah, I guess personally, the world's my oyster, which is really exciting. But yeah, I'm very content at the moment with what I'm doing, and with this specific specialism. I think it offers me the opportunity to pivot in a number of directions, which I'm quite grateful for.
Yeah, I can see that.
Yeah.
And do you think anything is missing from the profession at all? There's loads of different things that people have said before, like work-life balance or status, salary. It could be anything.
Yeah,
Do you think anything?
I mean, the salary. It could be better, considering what we do. However, having said that, I'm speaking from an NHS background.
Yeah.
And I don't think there's any NHS worker from the kind of more junior levels all the way up to your senior levels who would argue that we don't provide value for money. And I guess you don't go into the job for the money if you're looking to work for the NHS. Otherwise, you will be sorely disappointed. But I think, I guess from a physio perspective, if that is something that is important to you, and why not, then working privately is definitely an option. And again, another reason why I think physiotherapy is a great option, because it really is up to you where you want to go with it. If you so choose to take a slightly more kind of super specialised and private route that will have clientele available to you, there's that availability. But equally, if you want to go down the more public service route, and again, the range of opportunities that will offer you is there. So yeah, salary would be great. I suppose work-life balance, again, probably works in our favour. You really do. You can pick how you want to work. If you want to work crazy hours, if you want to do on calls, if you want to be busy, you have that opportunity. If you don't want to, if you want to have a more flexible lifestyle, that is equally available to you as well as a physiotherapist. So yeah, I'm a real champion for this profession, because I think it's great.
Yeah, I completely agree.
We're on board.
So where can people find you for more information? Like, you're so knowledgeable.
So I have social media. So I'm on Instagram at the moment under Her Kind of Physio. So play on the her side of things. So Women's Health Physiotherapy on Instagram. So yeah, no, I previously was based very much kind of between Liverpool and London, but I'm very much
Liverpool.
again.
What happened?
Liverpool, yeah. I worked at the Liverpool Women's Hospital.
Oh, wow.
Which is with a brilliant team. Absolutely loved working there. So yeah, but very recently moved back from Liverpool to London.
What brought you down to Liverpool?
I don't know. So I'm very much spirited in my kind of way of thinking when it comes to kind of how I live my life and what opportunities present themselves. I think it's really important to be flexible, and I think it's really important to be able to say, look, I want to give it a go and just see what opportunities are available to you and what you can learn and what you can offer as well. So yeah, that's something I guess has been quite important to me. It's one of my main values really. It's just being flexible and being open to learning more about yourself.
Wow. Did you enjoy Liverpool?
I did.
Yeah, you did.
It was very nice. Yeah, it was a great experience, definitely. Wow. Very character building. And the people are very sweet.
But it's been an absolute pleasure for you to come in on the show. I've learnt so much. You've been absolutely fantastic. So knowledgeable.
Thank you.
And I think everyone deserves the opportunity to at least speak to a women's health, pelvic health physiotherapist, just to understand what could be going wrong and to find some solutions for their problems.
Absolutely.
Or management for their problems. So I think, you're doing a phenomenal job, and really glad that you came to speak to us today.
Great. No, I'm glad to have come. It's quite nice to be able to kind of share with you what we do, because like you said, it's an essential role, so thank you.
So thank you for coming on, and thank you all for joining.